Where vulnerable women in the outskirts of the Nigerian capital, Abuja, have been receiving family planning service to help them properly manage their childbirth status amid the impact of the COVID-19 pandemic. The country's healthcare system has been largely disrupted by the global health crisis, but a non-governmental organization, Wellbeing Foundation Africa, is out to guide women in the remote parts of the country to improve their family management issues. Here are more details of that in this report.
32-year-old Miriam Salisu is pregnant with her 10th child. She's lost 3 of her children, 2 of her daughters are married, and her 4 boys are still at home. She says she and her husband have decided this baby will be their last.
I think I want to rest now because it's not been easy taking care of these children. Even to take them to school has been impossible. I don't want to put my body through the rigors of giving birth anymore. We would rather take care of the ones we have to the best of our ability.
According to Nigeria's National Demographic Health Survey, over 30% of young women in the country have no access to maternal health and family planning services. Months of lockdowns and the transfer of resources to combat COVID-19 have compounded the problem. Many poor people in rural areas who have suffered from the disruption of maternal health and family planning services like this are posed with the challenge of bearing more children than they can cater for. Despite the challenge of COVID-19, this non-governmental organization, Wellbeing Foundation Africa, is providing these services to Miriam and other women in this community on the outskirts of Abuja. They're also giving them education on family planning and contraception. The United Nations warns that the disruption of these services could result in more than 7 million unintended pregnancies worldwide in 2020.
We're able to convince them on the importance of the uptake of family services, and we even give it to them centrally where they can have maybe commodities like condom that they can use. If you can hear from the in charge here, you see that the percentage of people assessing family planning has now increased, unlike before.
However, experts say these programs are urgently needed in communities that are harder to reach.
The road is not good. You have poor network, telecommunication network. At times you want to communicate with them, you can't get through. 2, funding is another problem. You don't have support. Partnership, that's another key area that federal government have to look into, or other NGOs, international NGOs have to look into. If you want to reach out to people that really need the uptake of these services, then you have to extend your tentacle into the rural area.
Nigeria's Ministry of Health says despite the negative impact that the pandemic has had on the country's health sector, it's working hard to allocate more resources to family planning services. For now, women like Miriam are relying on the efforts of NGOs for vital family planning services.